$209 million. That's how much the state government is about to spend to fix Queensland Health's beleaguered payroll system. Nurses and the AMA have welcomed the action but agree with the opposition that it's a gross waste of money that could have funded hundreds of additional hospital beds.
Parliament sitting for the last time this year and tempers are running short. Beaudesert MP Aidan McClendon was sin-binned for ignoring the Speaker.
I therefore ask you to remove yourself from the House for an hour.
But the government was revealing the wages of sin, outlining the cost of fixing Queensland Health's payroll system.
The entire body of work is expected to cost $209 million over 3 financial years.
It is a great deal of waste.
Of that, about half will be spent on more payroll staff.
$210 million will give us 350 beds.
Our members are saying that they want the payroll system fixed, but not at the expense of healthcare.
Ernst & Young reviewed the $70 million system, which began processing pays in March. Hundreds of doctors, nurses and other staff got nothing, were underpaid or even overpaid. The report recommends keeping the SAP WorkBrain payroll system, duplicating the system so plan changes can be tested offline, and regionalising payroll.
The cost of fixing the bungled payroll system is obviously also being partly funded by the cuts to Queensland Health Services.
I tabled 2 Queensland Health memos from last month for the Metro South region that detail proposed cuts to critical palliative care beds for the dying.
The government says Metro South has budgetary problems of its own and it's a separate issue.
None of the cost of rectifying this issue will come at the expense of the operational budget of Queensland Health.
The Minister says all pays will be fixed by July next year, with the system further streamlined a year later. The unions aren't holding their breath.
It's a pretty massive stuff-up, so it's going to take a long time to fix.
And the payroll debacle has prompted a change to the whole-of-government administration plan. A report recommends scrapping the shared service agency. Instead, Queensland Health, the Department of Education and Training and the rest of government provider will soon look after their own patches. James Kelly, ABC News.